Thank you, Chairman, and good afternoon, good morning, good evening. I'm delighted to join the APACC conference this year to share with you about the implementation of PrEP services in Vietnam and our experience with self-testing. My presentation will focus on 4 areas. One, I'll be sharing with you about the timeline of our PrEP services implementation in Vietnam. The second one, I'll be talking about the differentiated strategies on HIV self-testing. Then next, I'll be sharing with you about the HIV self-testing as part of the PrEP service delivery. And last but not least will be the lessons learned or some key takeaway messages. So first of all, I'd like to share with you that before PrEP was kickstarted 6 years ago, a survey was conducted by the USAID PATH Healthy Markets project to assess the awareness, acceptability, preferences, and willingness to pay for the PrEP services in 2016 among the MSM and transgender women in Ho Chi Minh City and Hanoi, the 2 big provinces in Vietnam. The findings showed that about 91% of MSM and transgender people self-reported that they are at substantial risk of HIV. 89% of them would say that they would opt for PrEP if the service is available. And you see that 76% of them are actually willing to pay at the cost of 20,000 Vietnamese dong, which is about $1 per day for PrEP. And the preferred location for service they would like to receive PrEP is actually at the CBO office or at the community. So translating these understanding into actions, the first PrEP pilot in Vietnam was initiated in Ho Chi Minh City and a national launch for PrEP services in mid-2017. A year after that, in 2018, the National PrEP Scale-up Plan was approved by the Ministry of Health for the period of 2018 to 2020. PrEP is then expanded to 27 provinces out of the 63 provinces supported by PEPFAR and Global Fund in 2019. And in the same year, PrEP was first ever included in the National Care and Treatment Guidelines. In 2020, the Ministry of Health issued another PrEP scale-up plan for the period from 2020 to 2025. And since then, with the impact of COVID-19, the Ministry of Health issued a guidance on providing PrEP services during COVID, which allows the use of HIV self-test kit for HIV status monitoring among the PrEP clients. And just recently, in March this year, we have been successful in advocating for the tele-PrEP pilot approved by the Ministry of Health, which again highlights the use of HIV self-test kit in PrEP services. So with this table, I would like to share with you what HIV self-test kit products we are having in Vietnam for now. So Oral Quick was the first one that came into the market under the PEPFAR supported program. And these tests were very much preferred by key population because it used oral fluid and it does not cause any pain. So we are working with the distributor and the manufacturer to facilitate the registration of this test kit with the Ministry of Health in Vietnam. Since 2019, we start to have 2 more options for the HIV self-test kit, which is the Insti and Mylan HIV self-test that use the blood-based sample. So we expect more options of the self-test kit to be available in Vietnam in this year. So just to share a little bit about the differentiated strategies of HIV self-testing distribution in Vietnam, as a client-centered approach, we offer choices to clients for either an oral fluid test or a blood-based test, and clients can register and receive a self-test kit through an online platform or application or via CBO or a social enterprise office, a public or private health facility, or even at a pharmacy. They can get the test directly from a lay provider who is a CBO worker or health staff at a facility, or they can get it from their partners through the social network testing initiative or the index client testing program. And of course, they can choose to be assisted or to do the test by themselves. So with all these different approaches, we have been seeing a significant increase in the number of HIV self-tests distributed over the years from 2016 up to now. So during the COVID-19 period, we continue to see an increased trend for HIV self-testing, indicating that this is an effective approach to meet the needs of HIV testing and inclusive of that among the PrEP clients. So this slide takes you to another initiative that we put in place during the COVID-19 period to ensure continued access to HIV testing and other services in Vietnam. So basically what this is that client can view the advertisement for HIV self-testing. They can go online and complete a risk assessment form and order an HIV self-test kit and get it delivered to their homes. They are then followed up by the CBO or the social enterprise group member for post-test counseling and referral to services. So with that initiative, this gives you the results on the percentage of those who actually made the PrEP booking and enrolled in the service. So you see here 54% of those who ordered an HIV self-test kit then actually made a booking for PrEP, and then 26% of them then went on to receive the service. Also among the cohort, we also saw that an additional number of clients who did not book for the service but still enrolled in PrEP. So this really illustrates that online HIV self-testing platform can be an effective entry point for PrEP services. So now going back to the PrEP program, here you will see the expansion of the service coverage from 8 clinics in 2017 to more than 200 clinics in last year, 2021, supported by PEPFAR, Global Fund, and the national programs. So definitely what we have been seeing is that COVID was a big challenge for both providers and clients to ensure service continuity. So with the person-centered models introduced and scaled, especially with the HIV self-test kit and PrEP drugs distributed to the PrEP clients, we have been seeing an increase in PrEP uptake even during the COVID lockdown of 2021, and the trend is continuing to grow now that clients and providers have been able to find a way to overcome the barrier. Regarding the client profile, you see that the MSM clients are still predominant. However, but we also see a proportion of serodiscordant couples and transgender women, indicating that there's a need for differentiated care models that suits the needs of these key populations. So with this slide, we would like to share with you some further results of the remote PrEP services that were offered to clients during the most severe COVID-19 period in Vietnam from August to September last year, 2021, in Ho Chi Minh City and Dong Nai, the two provinces in the south that were really badly hit by COVID. So therefore, you see that about half to more than 80% of the clients actually received remote support for PrEP services. And these included the remote and online counseling, teleconsultation with the clinic doctors, and the home distribution of HIV self-test kit and PrEP drugs. You may see also on the photos on the right is that the clinic staff were packaging the INSEE HIV self-test kit and the PrEP drugs for delivery, and then they provided live video instruction to the clients and follow-up calls and messages for support. And with all of that efforts, we saw quite good continuation rate of 93% at month 3 for these PrEP clients. So in order to understand the client's feedback and satisfaction with the telehealth services to inform future scale-up, we carry out a small survey among the clients receiving these remote services during the period of July to September 2021, so last year. And here are some quick results to share with you. So you see that 90% of clients engage via chat messages. About more than 80% of them actually use video conference. And about more than 90% of them actually receive PrEP counseling, home delivery of HIV self-test kit and PrEP drugs. Another significant proportion of clients received COVID-19 care and support, and some of them receive the support for mental health and care for HIV care and treatment. And here is another set of interesting results that we have. So you see that about 84% of the clients share that they were either very comfortable with using an HIV self-test kit as part of the PrEP services, and 95% of them indicate that they use that again. So the strategies implemented over the past few years in response to COVID-19 to ensure continued access to PrEP, and the findings from the quick survey that I've just shared with you really makes us believe that it is really important to promote different convenient service options that are preferred by key population. And with the Healthy Markets project and now the follow-on steps project, we will continue to support the rollout of mobile or home care PrEP services, healthcare for transgender population, promote online demand generation campaigns, the comprehensive one-stop shop models, and that includes screening and diagnosis, treatment of STI, viral hepatitis, mental health, and so on. And given that HIV self-test kit has been extensively used for PrEP monitoring, this leads way to piloting and scale up of the tele-PrEP model, which I will be sharing with you in this slide. So the model really supports the convenience for clients who already enrolled in PrEP. So after enrollment, if the client decides to opt for tele-PrEP, they will receive a blood-based test delivered to their home, and other tests if needed, such as STI or creatinine test. The clients can have their samples collected at home and sent to the lab, and followed by video consultation with the doctor at the clinic. The drug for 3 months use is then delivered to the clients, and then the cycle is repeated every quarter. So what is key to tele-PrEP is that service booking and consultation can be done online and inputted into the electronic medical records of the clients. Then drugs and HIV self-test kit are distributed to the clients for HIV status monitoring. So with all that said, I would like to have some key messages for you to consider. So what we see here is that HIV self-test kit or HIV self-testing is an effective portal to PrEP and can be supportive of PrEP monitoring. Both HIV self-test kit and PrEP can be delivered by a range of models that diversify the choices and options for clients. And from the surveys that we have and other evaluation, we see that clients seem to strongly prefer HIV self-testing as part of PrEP services, such as in the model of home-based PrEP, mobile PrEP, or tele-PrEP. In order to diversify the product and also to increase uptake, it is important to diversify the HIV self-test kit market and also the market of PrEP products that help bring down the price and make it more accessible to our clients. And from all of the initiatives that we have been implementing since 2016, we are very fortunate to have the strong engagement from the Ministry of Health, which is key for all the successful scale up of the PRO program as an effort to increase service coverage. So with that, I would like to end my presentation here with special thanks to the Ministry of Health of Vietnam, the Vietnam Authority for HIV/AIDS Control, the public and private clinics, pharmacies, social enterprises, and CBOs who we have been working very closely with and make all of these programs successful. I'd like to thank the United States for Agency for International Development in Vietnam, our WHO colleagues, and special thanks to Dr. Kimberly Green and Dr. Vũ Ngọc Bảo at PACC and the other colleagues. So thank you very much.